Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. In this episode, I have the pleasure and privilege of having Shonda Palmer here to share her insights for coaches and healthcare providers on sleep coaching. Shonda Palmer is the founder and CEO of Shonda Palmer Wellness. Shonda coaches clients to apply mindfulness practices and overcoming sleep issues, making healthy lifestyle changes, managing stress, and improving performance in life and career. In addition to being a national board certified health and wellness coach and a certified lifestyle medicine coach through the American College of Lifestyle Medicine, she has completed trainings in cognitive behavioral therapy for insomnia, the Mindful Self-Compassion Program, and is triple certified as a Chopra Total Wellbeing Coach in meditation, Ayurvedic health, and lifestyle coaching. She mentors a global community of students as a faculty member of the Institute for Integrative Nutrition, is a certified sleep coach on an award-winning app, and is a frequent startup contributor and consultant. Shonda is based in the North County of San Diego and partners with physicians, chiropractors, naturopaths, and holistic mental health providers to help their patients get better sleep with mindfulness meditation and CBTI-based strategies. Welcome, Shonda.
Thank you so much, Jessica. It's great to be here with you today.
Same here. I'm so excited to explore this topic with you on sleep coaching, given your vast experience and expertise. And I'd love to know if we can just start at the beginning. What inspired you to become a sleep coach?
Oh, I love this question. I have sort of an unconventional story, and I think that it might be interesting for fellow coaches to hear for a couple of reasons. So I'd love to share. So I've been a health and wellness coach for 8 years. This month is my 8-year anniversary, and I have been a national board certified coach, as you mentioned in my bio, since 2020. And I started coaching women who were just like me, over 50, feeling stressed out, overwhelmed, to practice mindfulness and self-compassion and self-care through one-on-one coaching and in group programs. And I love doing that. It is so rewarding and just a wonderful, meaningful career to have. I did that for several years and enjoyed it immensely. I also work for IIN on faculty there. And I wanted to expand my reach some more and help more people. So I was looking for a coaching role where I could do that. And I found one, and I noticed that it was for a meditation app, a large meditation app. And I thought, that's it. That's for me. I'm a meditation teacher. I love mindfulness. And this is a great way for me to reach an even wider audience. So I applied for that role. And as I was interviewing, I found out, oh, this is not a mindfulness coaching role. This is a sleep coaching role. And I had some imposter syndrome. I actually have had sleep issues, insomnia, for decades. So I thought, how can I be a coach for people with insomnia when I have insomnia? But I really connected with the coach manager I was interviewing with, and I wanted to work with her, and I just felt like this was the place for me. So I went ahead and took the role and started to coach people, even though I was not sleeping myself. Well, fast forward I think it was about 9 months, maybe 6 to 9 months later, as I was continuing to coach people, I noticed two things. I noticed that even though I was not in a place where I wanted to be, right? I was not having perfect sleep. I was still able to provide value and help these clients to get better sleep. So even though I wasn't perfect, I could still help. And I think that's really important for all coaches, especially health and wellness coaches, because there is a perceived, perfection, like, oh, we have to have it all together before we can help anybody. But honestly, I am such a great example of that because I was not sleeping and I was able to help people get better sleep. So that was a big light bulb moment for me. And the second was that I started to sleep better. After about, like I said, like 6 to 9 months, I noticed that I was practicing what I preach. I was actually doing the strategies that I was helping others learn. And lo and behold, I was sleeping better. In fact, I can honestly say that I do not have insomnia anymore. So I'm really grateful for that. I'm still a sleep coach on this app and I'm helping people and I'm sleeping better, but it didn't really click for me that I was a sleep coach. I still just thought, well, I'm a health and wellness coach. And yes, I'm a sleep coach on this app, but in my private practice, I still thought of myself as a health and wellness coach who helps people with mindfulness. But I got that little tap on my shoulder, that little message from the universe that I needed to really step into this sleep coaching identity and take it on. So now I have a passion for sleep coaching, for sleep, for CBTI, cognitive behavioral therapy for insomnia. I have a passion because I've seen how it has impacted thousands of my clients and myself. So that's kind of a long story, but that's what really ignited my passion for sleep coaching.
I want to honor your authenticity and your journey, and talk about empathy, right? Your ability to empathize with your clients and those you serve when you're going through it yourself, and realizing that it's not necessarily about outcomes, having more of an understanding of that, and how behavioral change is really a process and something that we have to actively work on every day.
So true. And I think you hit the nail on the head by saying increasing empathy, because, of course, that is something that we have to have as coaches. And so I felt that my capacity for greater empathy was increased because of my own journey. That really helps me build rapport with my clients and just have that non judgmental, unconditional presence with them. And I think it just adds a little extra.
Yes, it also makes you reflect on the walking the talk aspect of being a health and wellness coach or a healthcare provider. I know that was one of the things I used to struggle with all the time, was how can I promote health for other people when I can't do it myself? And what I've come to realize, maybe from that space of empathy and self-compassion, is that it looks different for everyone. And maybe not all things are going to be perfect all the time. That's an impossibility. But accepting what is and working on what can be changed, even in little small steps every day, having that conscious awareness, that to me feels more aligned with walking the talk in a way that's more authentic.
Oh, I love that. And that is something that I share with my students who I mentor through IIN. We walk the talk, but we will never be perfect because humans aren't perfect. And so having that self compassion in our imperfection, and it really does help us to hold space for others when we're holding space for ourselves.
So well said. The other thing that's really interesting is, just with coaching in general, we provide this facilitative space of transformation. And especially, our scope of practice, according to the National Board for Health and Wellness Coaching, is we do not diagnose, we do not advise, we work with a healthcare team. And so, as part of the team, and it's really interesting when you start having niches in certain roles, like sleep coaching or weight loss or whatever it is, because if we're not providing medical advice and we're facilitating change, then where does the niche come in? Like, how does it differ from any other type of coaching? And so, on the surface, it takes a little bit of time to realize, wait a second, I think a lot of the role of a health coach also comes with health education and knowing what resources to refer. So, I'd love to know, based on your experience, what differences or what nuances you found with sleep coaching specifically as that niche.
Yeah, thanks so much for bringing this up because it is so important for coaches, especially that as we know, scope of practice. And when you have a niche such as sleep coaching, well, really any health and wellness, you will have clients who say, for instance, in sleep coaching, okay, what can I take? What supplements can I take? Can you help me get off my sleep medicine? How can I taper? And you get all of these questions that are out of scope for a coach. So how do you work around that? And honestly, I think having that conversation in the beginning, making sure that they're aware of our scope, right? Having that coaching agreement, even letting them know this is what a coaching session will look like. And this is a process, this is a discovery, and helping you as the client to identify those roadblocks and then overcome those roadblocks. Because, yes, I am a sleep coach. So I know a thing or two about sleep, right? And I really do know about insomnia, and I might even know a little bit about supplements, but I'm not going to suggest any. But I have an awareness there. And we all, as coaches, we come to health and wellness coaching usually because we have our own interest in health. So we might even research these things for fun. I know I do. But letting the client know what health coaching, sleep coaching, any niche coaching is, it's about overcoming those roadblocks. It's about getting you from where you are now, which may be a place of stuckness or uncertainty or wherever it is, to where you want to be, and creating that vision for what will life be like when you're sleeping better? What will you be able to do? What will be this beautiful vision of yourself? Creating that with the client, of course, will build that self-efficacy, will help to have them anchor to that, that big why. Like, why is this important to you? Let's talk about that. And letting them know, wouldn't it be great if I could just tell you what to do? But unfortunately, we know that that's not helpful. There's resistance. When someone tells you what to do, you're going to resist that. That's just human nature. So let's really find what will motivate you, this beautiful self-motivation to get you to where you want to be. Now, in the context of sleep coaching, there is some education, right? We want to be able to provide some resources and some education to the client, and always putting them in the driver's seat. But so asking permission, gauging or assessing what they already know. And I will tell you that people who have insomnia know a lot about sleep, a lot. And in fact, most of my clients did know more about sleep when I first started sleep coaching than I did, because they've had sleep issues for many, many years and they've been trying to find answers. So they know. And that's something that I share with them, that if it was just a problem with lack of information, you'd already be sleeping, but you already know. So let's find out what will work for you and what doesn't work for you. So tell me, what do you know about sleep hygiene or cognitive restructuring or relaxation, whatever it may be? And then I can gauge, okay, well, there are a few things that you may be interested in exploring. And something I love to do with clients is, after asking permission, and they're like, yes, I'd love to learn more. Well, I have this menu of options and I'll have several different things that they may want to explore. It's not me telling them what to do, but just offering, just as information. And I find that's really helpful.
So many key valuable insights in what you've just shared. And that piece about not being wanting to be told what to do, having them be wise, having them have this wealth of information. I feel that's really where coaching has this enormous potential to bridge gaps in our healthcare system. Because when you go to the healthcare, traditionally you go to your healthcare provider, it's this is what you should do. And there's not really that opportunity most of the time, unless it's an integrative practice or, someone really has that space to take that time, which usually the system doesn't allow, to figure out how can they make what's medically recommended work for that specific patient, for that specific person's life. And like you said, people come to coaching because they look for the answers. And so sleep coaching really is such a wonderful way to help bridge those gaps, I find, in medicine. And with the niche, again, yes, it's the health educator role. And then the patterns you recognize, the behaviors you see, the challenges you see, just unique in the niche of sleep coaching. Your ability then to facilitate transformation by knowing how to ask what questions are going to bring this person to this space of new thinking, that all, I imagine, just builds so much on each other in the niches that we are in.
It really does, Jessica. And it's been so heartwarming to hear back the feedback from my clients on how they were so surprised that by going through this process of sleep coaching, they were able to transform other areas of their life, their relationship with themselves in particularly, and how they treat themselves, the self-care, even more traditional or conventional areas such as diet and exercise. All of these things do play into sleep. So making these small steps, these, even I say these micro steps, help them to then feel that greater ability within themselves to tackle these other areas. It's so holistic. So one thing does impact another. And how we do one thing is how we do everything, right? So having more compassion and more consistency, really, in the sleep areas will bring that consistency in other areas of their life. So they see a complete and total transformation.
Holding that space for transformation for our clients is so powerful and one of the biggest rewards I find in coaching. And I wanted to ask you, with sleep coaching, what is CBTI and how has it been helpful? Because it's also hard when we talk about scope of practice. And so, how does CBTI fit into this? Because I see that for sleep coaching, it seems to be a technique that is becoming more and more commonly known and one that is very powerful with helping people sleep better.
Yes, absolutely. I love to talk about CBTI. So, cognitive behavioral therapy for insomnia. So, we hear that CBT part, right? Cognitive behavioral therapy. So, we think, oh, CBT, I know that from therapy. You know, my therapist helped me with CBT. And it's reframing and seeing the pattern of our thoughts create emotion, which drive our actions, which give us results. Right? That's traditional CBTI. And yes, there is an element of that in CBT insomnia, but it is different. Interestingly, I've heard several sleep medicine doctors refer to CBTI not as cognitive behavioral therapy for insomnia, but cognitive behavioral treatment for insomnia. So, again, kind of differentiating between therapy and practical skills treatment that we can offer. But CBTI is the gold standard for insomnia, and it's the first line approach for physicians before sleep aids medication. And it is a really powerful protocol using the cognitive behavioral changes, of course, hence the name, but using relaxation, using cognitive restructuring techniques, and the psychoeducation, which is really important piece of the CBTI. And clients will honestly start to see results very quickly. Sometimes it only takes 4 sessions. When working with a conventional CBTI provider, maybe like a coach with hour-long sessions, it could be 4 weekly sessions or biweekly, but it could also be a bit longer, 6, 8 sessions. It really just depends on the severity of the insomnia. But this is, like I said, it is the gold standard approach, and it is an exciting, I hesitate to use the word treatment, but it's an exciting protocol that coaches can use because you don't have to be a physician, a therapist, a psychologist. You don't have to be, because, like I said, it is a practical skills um, treatment, I guess. And so really anybody can learn this. And there are many ways to learn CBTI. There are books out there that people can get. There are, apps. Like I work for a sleep app. There are other programs that people can use. But I do see a huge difference with the one-on-one. and having somebody to support you through these protocols, through these strategies, right? So having that support, having that accountability really does make a difference. But this is something doctors are learning more about. It's still, there is such a scarcity of CBTI providers. And it's too bad. It's a shame that there are so few, because people who are looking for a CBTI provider, they're seeing wait times from minimum 6 months up to a year to get into clinic and see a CBTI provider. So this is where coaching can come in and fill that gap and support the folks who are tired and have insomnia, and also really support the physicians and psychologists and all those healthcare folks who just don't have the time to help the people they want to help. So we, as coaches, it puts us in this really wonderful position of, we're helping the people who need this strategy, who need this coaching, and we're helping the physicians who are burning out. As you know, the physicians are burning out and they need that support of a coach. So I get pretty passionate about it.
Yeah, you were talking about the scarcity of CBTI providers and just the scarcity overall of sleep education. Whether in our formal education, elementary education, medical education, it's unfortunate. And even with coach training, there's no standardized requirement for sleep education. We have competencies, but it's really up to us to be proactive. And it's such a key aspect of health. So really is imperative for everyone to know. It's interesting because it also talks about the coach mindset and this lifelong learner mindset, because when you go in through coaching, you had talked about how anyone could really learn to practice CBTI. And it's so empowering, just that self-education, because then we can help fill in gaps. Obviously, it's important to know when to refer, when we need a provider, and those things are critical. But outside of that, there really is so much we can do to help people.
There really is. And of course, we want to have that education, and we want to be able to provide evidence-based strategies to people. But this is a way where we can help people in a really significant way without being, as a coach, like, I'm not a doctor, I'm not a psychologist, but I can still help these people in a way that will make a huge difference in their lives.
One thing I also find really interesting is the fact that you're a sleep coach for an app, and it's like counterintuitive because you think of texting and like not wanting to be by your phone at night. And I know that's not exactly how the app is used all the time. So I think and there's so much technology evolution with artificial intelligence as well, and really embracing learning. It's so important for us to learn how to embrace this technology because it can help so many people. And so I'd love to learn your experience about the impact you found with your experience in text-based coaching.
Yeah. So this was a learning curve for me. So coming from one-on-one coaching to group coaching, when I started working for the app, I learned this is all text-based. We use a platform and we're messaging. So yes, a client can indeed message me 24/7, in the middle of the night, but I, of course, am not going to respond because I have my work hours and firm boundaries around that. Um, but this is, like I said, it's a learning curve, right? So being able to translate my coaching skills into a text message, it takes some practice, and it's been interesting. But I have been really pleased to see how the clients are just loving this. They love having that ease of access, being able to pick up their phone. Of course, I do encourage them not to use their phone or device in their bed, and to reduce light in the evening and technology 3 hours before bed, all that good stuff. But it is really, like I said earlier, so supportive. And that is one of the beautiful things about having a coach, is feeling supported. So they know that they can just send me a message at any time. They can share their wins. They can share the things that are hard, right? Sometimes they just need that emotional support. So I try really hard not to be a cheerleader, of course, but encouraging them, helping them to see their strengths. And we talk a lot about that. So I'll ask questions, right? Open-ended questions to them where they can then reflect on and take time, right? So it becomes this reflective journaling experience for them, but somebody's actually reading their journal. And that's powerful. And so many clients have told me it's just so good to have someone there and listening to me, because most of these people, so people who have insomnia generally are very like type A, they're driven, they're CEOs. I've worked with surgeons, anesthesiologists, commercial pilots, military. So these are the people who are go getters and they're amazing people, but they can't sleep. And so they can't really talk to anybody about this, right? They feel very alone and isolated. So having a coach who sees them from this space of unconditional presence and that I am truly seeing them as their best self and helping them to see that within themselves, I think that's part of the beauty of coaching.
Just reflecting on the people you mentioned, especially in those fields, all high stress, very high stress jobs.
Yeah.
And I was kind of just, as you were speaking, reflecting back to my days when I was in residency and it was all regular shift work. And I kind of just gave up on trying to have any sleep help whatsoever because I was like, what can I do? And I'm wondering how I would have felt if I had an app where I could just text someone, even just to have that mirror to myself.
Yeah.
Because I know, like, I could have fallen asleep and I tried to reward myself by watching whatever I watched. I watched way too, for saying I didn't have time. There was a lot of binge watching that happened. And
Mhm.
I saw my mental health just kind of go down. And I knew it was better when the screen was off, but it was just, it's difficult. And then when you don't have a regular circadian rhythm, it's hard to know when to stop drinking anything, when to stop eating things, and because the same rules don't apply when your schedule is off or if you're working nights. And so
Right.
everyone has their own answers. Mine might have been a little extreme. I found the thing that worked for me was to keep a daytime eating schedule, even if I was working at night. You just try to follow it, but it might not be the answer for everybody. And so it's very interesting and very powering. And I'm grateful for the service and impact that you do just by being able to have someone to share with, to be able to share honestly, who's not going to judge you or say, like, you should you.
Right.
It's just, it seems like it must make such a huge difference.
It really does. And everyone is unique, just like you said. So finding what works for them, right? I often tell clients, okay, this is a chance for us to find out what works and what doesn't, because you've done a lot, you've tried a lot. Often they come to sleep coaching after, trying everything else, right? And they're feeling pretty hopeless and discouraged. So say, you know what, it's just part of the journey and we can find what works, and finding out what doesn't work is just part of that journey. And we can take the things that you've learned and add to it. This is coaching, meeting people where they are, finding out, okay, well, what's worked? What might have worked maybe 10 years ago? What are some things that maybe you could get back to? Or, what didn't work at all that you don't want to touch with a 10-foot pole? Like, let's talk about that so that, okay, now we know, now let's move forward.
And that alone just provides so much hope, that feeling of getting unstuck.
It really does. That's everything, right? Hope. And that is the number one word. It's so interesting that you said that, Jessica, because that is the number one word. All of my clients across the board they've shared that word with me when I ask for their takeaway or how are they feeling. And they say, I feel hopeful. And what a gift that is. And it's an honor, really, to be able to just to hold space for that. And I'm not giving them hope. They're cultivating that within themselves as we go through the process together.
You provide the space for them to find their own hope.
Yeah.
Speaking of takeaways, I'd love to ask you. I'd love to ask you, for coaches listening to this, or for anyone interested in becoming a sleep coach or learning more about sleep and their health care practice, what advice do you have for them?
Oh, so much. Yeah, I think from my trainings in mindfulness and self compassion and how they've really informed all of my coaching, but specifically my sleep coaching. I think my takeaway and what I'd share is that first and foremost, always cultivate your own practice of mindfulness and self-compassion. With sleep coaching, I'm going to be honest with all of you coaches. Tired people are cranky and they can't help it, right? Like they don't have good sleep. So, of course, they're going to be a little grumpy, right? And so, really cultivating your own mindfulness and self compassion so that you can hold that non judgmental space is really, really important. And to see with those eyes of empathy, right? So that's one thing that I think is really important. And as you cultivate your own self compassion, what you're doing is modeling. So again, you're not like holding yourself up as this perfect cookie cutter model that they should follow. That's not it. You are practicing your own self compassion. And what that does is come through to your clients, and they're able to really receive the benefit of your self compassion as you are holding that presence. And you may not say anything about it, but it's there and they can feel it. We all know that, right? There's that energetic sharing between coach and client. So as you are exhibiting self compassion, that helps someone to start to feel it within themselves and to develop the self compassion within themselves. So holding that space for yourself and all the bumps, all the highs and lows, and that will make a big difference for your client. So compassion, self-compassion is paramount in working with this population of people, sharing with them that, and that, of course, the education piece of sharing how self-compassion comes in when they didn't sleep all night, when they feel terrible, when they snapped at their loved one because they're tired, like all of the things, right? So helping them to then practice what it's like to give themselves compassion when they're tired, when they're cranky, and that this is part of the journey. That's my biggest takeaway and share for other coaches. I have a big passion for self-compassion along with sleep.
I love that advice because it's so coach-esque in so many ways, because really the advice is to go from within. And that's what we tell our clients, and what we do is we provide that shift for transformation. And so just holding that for ourselves rather than saying you need to learn X, Y, and Z or do whatever to become a sleep coach, it really just starts inside.
Oh, beautiful reflection, Jessica. That's where it really starts. And we could have 10 certifications, but it really starts from within.
Thank you so much for sharing all these beautiful pearls of wisdom and your insight.
Oh, thank you so much, Jessica. You're providing so many resources and such a safe, beautiful space for coaches. Thank you.
Thank you for listening. I appreciate you and value your feedback, so please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.